Hi, everybody. It's Jessica DeMassa with What's the Future Health. We are talking to the who's who of health technology and healthcare innovation. And joining us today is the founder and CEO of a company called Embold Health. Please meet Daniel Stein. And Embold Health, this is really cool. You guys caught my eye because you have a partnership with Walmart that we're going to get into in a second. But what you guys are doing is kind of taking like this idea of the idea behind centers of excellence and applying it to the individual physician level so that people who work for employers can find the best doctors who provide the best care. And I know you guys are focused on, you told me primary care is hot and also specialists. And so we'll dive into that. But Daniel, welcome. It's a pleasure to have you here today. Thank you so much for joining me.
Well, it's great to be here with you. Thanks for having me.
Why don't we level set by just having you introduce Embold Health, like just the basic intro. What do you guys do?
So we help employers improve quality, and we help them improve quality for their own people, their own employees, and we help them improve quality across the communities that they serve more broadly.
So this is like a data analytics play, right? And so I'd like to jump in on the data that you guys have, because in our pre-interview chats, I've been very impressed by hearing all of the things that you're looking at when you're trying to assign quality to a physician. And this is a group that's benchmarked all over the place. So tell us a little bit about that data that you're looking at and how it's different and how you're actually providing a much more robust assessment of quality as a result of it.
So healthcare is like a total black box right now. When you go to a doctor, you have no idea what kind of quality you're going to get. You may know where they went to medical school, you may know their Google reviews, but in terms of whether they're actually good at what they do and deliver high quality care, you don't know, I don't know, the employer doesn't know. So what we try to do is bring visibility into that by looking at the physician performance based on what they actually do, how they went to medical school. And so we look at three things, Jessica. We look at the appropriateness of care, which means, are you actually getting care that helps you and that's needed? Believe it or not, there's a lot of care that doesn't. The second thing we look at is your outcomes. When you deliver care, are you getting good outcomes for it? And then the last thing we look at, compared to your peers in the market, are you cost effective? Are you delivering it at a reasonable cost structure? So we take that information and we make it digestible and understandable for an employer and for those employees to start changing who they use for their care. And then we take that information, we make it usable for the docs too.
Okay. I want to unpack all of that, but I want to ask one more quick question about the data behind that. So how is that, like, what are you pulling from to make those, to discern whether or not somebody is delivering the right kind of care at the right cost? Like, what kinds of things are you looking at?
So from a data perspective, you need a huge amount of data.
Yeah.
So there are over 1 million docs in this country. And if you want to get enough data to understand how they perform, you just need a lot of it. So we work with BlueCross BlueShield and access their national data set to be able to really understand at a high level reliability of how docs perform, because it's one of the biggest data sets that exists. In terms of what we look at, let me give you an example.
Yeah, that'd be helpful.
Yeah, and I was going through this with my wife not long ago. So, when she was picking an OB for her pregnancy, we want a doc that's not going to do a C-section unless it's absolutely necessary. So one of the things that we look at for healthy pregnancies is the C-section rate. And Jessica, what we see is there's just this huge amount of difference depending on what doc you go to. Some docs are doing C-sections 10 to 15% of the time, which is what the science actually recommends. And there's some docs that for healthy pregnancies are delivering C-sections literally 60% of the time.
What? 60?
Over half of all mothers coming in.
Wow.
So
that's a discrepancy. And so by using Embold Health, you're able to get that level of detail based on the data that you're pulling using the BlueCross BlueShield data set.
That's exactly right. So like for that obstetrician, we're looking at probably a dozen and a half measures to make sure that they deliver high quality care. And then we take that information and we make sure that you as an employee have access to it when you're making that decision what doctor to see. And for the employer, they get to then layer on ways to help make it easier for you to get there.
I read about the Walmart partnership, and that was the reason that you guys were on my radar, to be honest, from the beginning. And one of the things that I read in that article, or that I recall from it, was that Walmart was incentivizing their employees to go to doctors that you guys had highly rated because of the cost savings long term. So tell us a little bit more about that partnership. I mean, it's more than a year and a half in. This is a coveted employer that you're working with. I took a peek. There was you guys hosted a webinar, and one of the HR benefits managers from Walmart was on there, and she had nothing but glowing things to say. So tell us how that partnership is going. I'm curious, and I'm also curious about some of the ways they've helped you refine your offering, because I can't imagine that they're very hands-off.
No, they've been very hands-on with us from the beginning. I couldn't ask for a better partner. And I couldn't ask for a better partner because they understand, Jessica, something that I think more and more employers are getting, which is the best way to control your costs long-term is quality. Quality is the best and most sustainable way to control your costs. So with Walmart, what they did was, they wanted to make it easy for their employees to get to use higher performing docs. So they use our technology where we have our doctor ratings that are available to their employees. But then they also created a benefit design and financial incentives to encourage financially their employees to go use those higher performing docs. And then with them, we also went and fully integrated it within their health plan offering. They use BlueCross BlueShield as one of their main carriers. So it doesn't matter if you go to our tool, if you call the insurance company, or if you, just happen to see who's in network for you. Everything is kind of pointing you to the same place to use those high performer docs.
Okay, I'm curious about one of the things that I picked up on that webinar was one of the things I liked that the HR benefits manager from Walmart said was that she liked the way that you guys work with providers. And I thought that was a really important comment, because if you look at this on face value, you guys are rating docs, which usually never goes well. So the fact that, and I'm curious about specifically they work with the providers. So tell me about working with the providers and whether or not you're hated, because I can't imagine, especially when it comes down to ratings, it's like they're being looked at with a lot of different data. I mean, and depending on, the rating organization, varying scales of reliability there. So tell me about the providers and how they've been reacting to what you guys are doing.
So Jessica, this is core to who we are in our mission of improving quality. Like, you can't operate in the dark and you can't improve in the dark either. And so the docs need visibility into how they perform. And I can tell you, as a doc myself, I never got any feedback on how I practice relative to the latest science. I never got any feedback on how I practice relative to my peers. So that's the type of data that we bring to them. Same data that the employer has, we share with the physicians and the health systems to say, here's how your docs perform on the highest impact, quality, and cost measures. Here's your opportunities where you've got exceptional performance, and here's your opportunities where you have opportunities to get better. And so we take that information and we share it with them. Now, does it
go well or not?
Yeah, I mean, I think look, docs are competitive. We're a competitive professional. We are all used to being above average. It's like woebegone in medical school. And, we're all used to being these students. So I think that when you share data with physicians that show they've got opportunities to improve relative to their peers or the latest science, that doesn't hit nicely. And so our job, and this is how we work with the employers, is to work with the physicians and work with those health systems through those stages of grief, through the anger, through the denial, through the bargaining, to get to the place where we can say, okay, here's the data. You understand exactly how it is we measure it. You understand exactly where it is it's coming from. Now let's think about, what do we want to do about this? How can we improve? And one of the things that we've learned through the experience with Walmart is there's a very consistent cycle that the providers go through. And our job is to help go through that as quickly as we can, and then land on, okay, here's what the employer wants. Turns out that's pretty similar to what you want. High quality care delivered consistently. Here's our opportunities to improve. Let's now get after it.
I understand one of the places where you are kind of gaining ground with providers is on referrals. So tell me a little bit about what you guys have been learning about referrals and how you're helping empower physicians with better information about referrals.
Well, this is an area near and dear to my heart as a primary care doc. So with employers have made huge investments in primary care, and some of them have come through on-site clinics. Like, I know you guys have had crossover on here before. Some of them just, have made investments in the community primary care docs. And so what we're hearing from employers is, can you take your data around specialist performance, around those OBs, around those spine surgeons, around those cardiologists, and can you help our primary care clinics and our primary care doctors make better referrals using it? So we go into the primary care docs just like we do the health systems and say, here's the list of docs who you refer to. We know it because we see it in the data. And here's how those docs perform. And Jessica, the really interesting thing is that we found is those docs are totally surprised.
Really?
Surprised how big the referral is, like how many different doctors are part of their referral networks. And when we start showing them the data on how they perform and then unpacking it, why they perform a certain way, the light bulbs just start going on. And we hear over and over again, I've never seen data like this before. And so then what we do is we work with those primary care practices, same thing. Let's focus on where the highest impact opportunities are. And instead of having 10 cardiologists that you refer to, 5 of which are above average and 5 are below, let's narrow it down to those 5 that are above average.
I like that. I like how this fits into with like the whole concept of centers of excellence, which I know Walmart was like famous for at the very beginning, but a lot of other self-insured employers have taken on this same kind of approach of working with centers of excellence for more complex surgeries, knee replacements, hip replacements, things like that. And there are even some companies like Carum, which just raised some money, which is like trying to digitize the marketplace of that, which is pretty cool. And so you guys are kind of on the other end of this and helping fill in that blank there in the middle. Is that not a space that we get covered by like some of those second opinion referrals companies like the Grand Rounds or like Second MD that just got acquired by Accolade? Don't they fill in that bucket to help with referrals?
Yeah, it's largely been that this space has largely been unaddressed, helping find high quality providers in the local market so you don't have to travel. I think what a lot of employers like Walmart found was if you send your employees to these centers of excellence, to these really high quality places, they're going to get high quality care. A lot of the things they're being sent there for Walmart, literally half of all spine cases, when they are being told they don't need what they're being sent there for in the first place. So it proved kind of the thesis, higher quality care is lower cost, medically appropriate care is the right care. But that's a pretty big inconvenience to make your people fly all across the country. And so what we know and what our data shows us is there are high quality docs in every community. Mm-hmm. We just got to find them and we got to engage with them. And then we got to share with the other docs the opportunity to get better, because that's really the only thing that's sustainable over time.
How did COVID-19 change things for you guys? Did it at all? Or and I asked that in the context of not only working with, providers and trying to assess quality and now having to do it by taking into consideration things that happen virtually, which is a whole different animal, right? Because some places were better prepared for that than others. But also on the employer side, I feel like there was just a lot of scrambling all around to make sure, and I saw it like across the entire space, across health tech. It's like from the very moment where it was like, okay, nobody can go anymore. We need a telehealth solution. It's like, depending on who the employer was, it's like they just, they launched into different degrees of action based on what they already had in place and what they didn't and how they could shore things up. And, that just kept evolving over last year into now. So when you're thinking about like your own business, I think, I'm curious to hear how COVID-19 has impacted you and what some of the things that have maybe changed, with providers and also with employers as a result of, what you're doing there, rating quality.
I think most employers last year were focused on the basics.
Yeah.
Keeping our employees healthy, the dividers, work from home, definitely telehealth. Digital health. These were big solutions last year because, people were home and you had to get them care. What we're seeing now in the employer market is this reawakening to begin to think about not just point solutions, but strategically, how should they be thinking about quality? How should they be thinking about network? What's their place in the community more broadly? And so we're seeing a lot bigger thinking begin to reemerge in the employer community. And this kind of emergence of quality is the thing that we should be focused on. The quality is what's going to drive our type of sustainable. I just don't think, to be honest with you, employers they couldn't do that last year. They were so focused on helping their employees stay healthy and helping them get the care they need. So we're seeing a lot of pent up demand in the market now, where it's like, all right, we got 2 years of strategy work that we got to do. Let's get after it.
Awesome. I love that. I love that. So what about you guys as a business? How are you getting after it this year? I know you guys have raised about 30 million. That was a little while ago. So, I mean, like any startup, I'm sure you're always fundraising, but give us a sense of Embold Health, the biz. Like, how many are you? Where are you based? Like, give us the details about the company.
Yeah. So we're based in Nashville, and have about 50 people who work for us now. We launched with our first set of employers across the US last year. So as part of the 2020 year. And now we're in growth mode. Okay. We're out there bringing on other employers who want to do this for this coming year, expanding with existing accounts, and really diving in deep as the providers and the health systems begin to come out of this shellacking that has been COVID, beginning to engage with them around how do we improve. And I think, Jessica, what we're seeing in the market is there are a lot of companies now that claim to rate docs. Like it's a thing. It's become hot. Exactly. It's a thing. When I'm on your show, it must be a thing. And I think the thing that we're seeing though that sets us apart, and we're hearing this back from employers, it is that transparency. It's that willingness to actually share the data. A lot of companies kind of take the proprietary black box, can't share it. And so kind of the thing that sets us apart is saying, look, we're going to help you, the employer, for your own people, but you got a bigger role to play here too. And that bigger role that we're going to do together is to help the providers improve for the community more broadly.
I love that, because that is, I think, such an altruistic kind of use of that type of information. It's to really raise the tide so that all boats can lift alongside one another. And I like how it's community focused as well. I think that's really important. And I think, especially after last year, when certain communities, lost their hospitals, or there was such a focus on hospitals in the heroic role that they played, but also in some of them suffering really tragically from just, lack of being able to run their businesses the way that they always had. I think it's really important that there's this community improvement bent in connection to having local health systems be strong, and what you guys do. I think that's awesome. Kudos to you on that.
Thanks. It makes it fun, and it makes it fun too. I mean, you probably heard this on that webinar you were referencing from Walmart. Most employers, even huge ones like Walmart, they know they aren't big enough on their own. And so it gives them the opportunity to work with other employers to come together on that community good.
I love it. I want to see like a self-insured employer super group that just starts making some crazy decisions. That's my hope for 2021.
I think we should work on that.
Okay, I'm in. I think I know a couple other folks who'd be in on that too.
Well, good.
Stein, from the CEO of Embold Health, thank you so much for joining us here today. It's a pleasure to hear about your business. And like I said, I think it's a unique spin on this. And I wish you a lot of great success. Thank you so much for stopping by and chatting with us.
Thanks, Jessica.
All right, we'll talk to you soon. And for the rest of you guys, please check out the rest of the interviews I have with some of health tech's leading innovators over there on my YouTube channel. It is WTF Health. Just search it and you'll find it. We'll see you guys soon. Thanks so much for joining us.